All right, good afternoon and welcome to UMAC TV. My name is Kamal Erkan. Today is our clinical presentation for our diabetes program. As usual, I have Caroline Weber with me and also Donna Gunkel. And today we have two panelists with us, Celeste Millner and also Ken Rodenheiser going to be with us. Our discussion today is continuous glucose monitoring, which is an extremely important part of management of diabetes. Many people who are dealing with diabetes, they may not have a really good understanding of checking your diabetes throughout the day and kind of going, seeing the fluctuation from morning to the afternoon, afternoon to the evening. But throughout the day, if you can actually see problematic times, so this is why it's important for us to really understand what's happening. So that way your endocrinologist or your primary care can make the best decision with your medication and other management of diabetes issues. So I will ask our guests to introduce themselves, so we can start with Celeste.
Hi, thank you for having us. My name is Celeste Millner. I've been a certified diabetes educator for almost 19 years, and I am the territory business manager for Dexcom.
And my name's Ken Rodenheiser. I'm a registered nurse and also a certified diabetes care and education specialist. I cover from Cherry Hill, New Jersey to Altoona, Pennsylvania from a clinical standpoint. So talking today about Dexcom, what is continuous glucose monitoring, how it's beneficial for you. And then towards the end, talking about, how do we get it? But just grateful to have the opportunity to speak with everyone today.
Thank you. Caroline?
I am Caroline Weber. I'm one of the dietitians on staff and help to coordinate the diabetes and nutrition program. Also do counseling for patients for individual nutrition medical therapy.
And good afternoon, everyone. My name is Donna Gunkel. I am the Director of Clinical Integration for United Medical ACO. So I oversee all of the clinical programs, including our accredited diabetes program.
All right, well, thank you. So Ken, if you're ready, we can start with your part of the presentation.
That sounds great. So I'm going to do the typical Zoom. Does everybody see my screen?
Yes.
All right. So as I said, my name's Ken, registered nurse, certified diabetes care and education specialist, and really just highlighting continuous glucose monitoring to start. So power of just CGM, power of Dexcom, we no longer have the need to do finger sticks, right? There are occasions where we may still have to do one or two occasionally, but primarily no more finger sticks needed. Dexcom, our latest generation, the G7, is the most accurate sensor on the market right now, and that's measured through the MARD. That stands for mean absolute relative difference. The lower the MARD, the higher the accuracy, and that's just, again, a fancy way to measure the accuracy. And then really the benefit of Dexcom is seeing what food, seeing what medication, seeing what exercise does to your blood sugar in real time. And we can learn so much about our bodies and find out what is working, what is not working, and what we can do a little bit differently. And then the benefit for safety, we get alerts before we go low or when we're high and out of range, above target or below target. We can see all of that. And the gold standard right now is still finger stick glucometer readings, but there are some challenges with the finger sticks. So number one, we don't get trends of where we've been, where we're going with glucose readings. We get one moment in time. And I always like to think about, a still frame picture compared to a video of recording about what's happening throughout the entire picture. Next, these values can be skewed. What if we don't wash our hands appropriately and we have some glucose residue there? What if we wash our hands appropriately, but don't dry them appropriately, and now the sample is diluted? We can get skewed values and make treatment decisions based off of inaccurate readings. And there's long times between our finger sticks. Even if you're checking 3, 4, maybe even 5 times a day, which is a lot for most people, that is only 5 seconds throughout the entire 24-hour day where we are getting data and we're missing a lot of valuable information there. You know, oftentimes when I was in clinic, people told me, you know, I forgot to check here, or, oh, I just busy, it slipped through my mind. And we miss these critical highs, we miss these critical lows, and they could be really detrimental to safety and overall well-being and control of your diabetes. And then one of the biggest benefits is being alerted when we're out of range, like I mentioned before. And that's something that finger stick glucometers just can't do for you. I like to pause here. This is a wonderful picture that was done by Adam Brown and the Diatribe crew, just talking about, you know, the 42 factors that we're aware of that affect blood sugars. Some of them make us go up, some of them make us go down, some of them keep us steady but might impact us later, and some of them, like altitude, number 38 in the environmental section, we just really don't know how that affects every single person. So there's a lot of things that go behind why your glucoses are out of range. And we can't pinpoint everything with 3, 4, 5 finger sticks a day. We need something that's much more continuous. So here's what a continuous glucose monitor is, and I hope everyone can see my mouse. So it is a little tiny sensor wire that goes underneath the skin, and this is introduced by a needle, but the needle is retracted in a second. And then I'm going to hold it up to the camera if everyone can see. If not, you can go on our website and see that it is a super, super tiny sensor that lives under the skin, and it is about the width of an eyelash. I had one person tell me one time, you know, it's like a cat whisker, and that kind of nailed it too. It's kind of like a cat whisker that lives underneath the skin. And what it's doing is measuring those glucose molecules, those sugar molecules that are floating by the sensor to determine how much sugar is in the interstitial body fluid, not the blood. There's a difference in value there. And it's going to give us a reading once every 5 minutes. Dexcom gives us a reading once every 5 minutes, which is 288 values in the day, showing us a lot of information to make the best decisions for your care. Finger sticks, we don't have that ability. And like I said, there's no predictive alerts and alarms and features with finger sticks. So when we measure continuous glucose monitors reading, when we measure to see how you're doing overall, generally the target range is between 70 and 180. Your healthcare providers might change this, but generally it's between 70 and 180. So when we do finger sticks, like I said, 4 times a day, wow, look at this. Every single glucometer reading is in range, but we're missing so many data points. We add in Dexcom, we add in CGM, you know, every 5 minutes we get a reading 288 values in a day. Now we get to see that undetected hypoglycemia. You know, this is what's happening overnight. If you're having hypoglycemia overnight, that's pretty scary. That's pretty serious. That's an acute issue that we need to address as soon as possible, but we're missing that with that finger stick reading. And then the undetected hyperglycemia, you know, this is what makes you feel sluggish throughout the day. This is what makes you not feel well. And this is what can cause those long-term complications that we always try to avoid with diabetes. And we can now see it. So I'm going to go back a little bit. You know, that finger stick, we're not going to make any changes here because everything that we're seeing is quote unquote in range. But then we add this additional tool, we add continuous glucose monitoring to our toolkit, and we can see so much more, make so many more impactful changes. And the biggest question I get from patients a lot, and you know, I'll wear a Dexcom shirt outside and they say like, oh, I've seen a commercial for that. It was in the Super Bowl. Is it right for me? And my always gut reaction is, yes, everyone can have some value in CGM. But let's not take Ken's stance on it. Let's take the American Diabetes Association stance on it. Let's take the American Association of Clinical Endocrinologists stance on it that say, depending on the type of medication regimen you're on, you should have different types of continuous glucose monitors out there. So there's the real-time CGM, which is Dexcom, right? Once every 5 minutes, you get that real-time glucose value so that you can make that decision in real time, versus the IS, the intermittent scan. That's where, you know, it replaces the finger sticks. It's a good product, but you have to swipe over top of it to get that value. You know, I've had patients in the past who forgot to do finger sticks and they forgot to swipe. And while it was extremely helpful, they forgot to do things and we still didn't get those values. But with the real time, once it's connected, every 5 minutes, you're getting that reading. So what the ADA stance is that anybody on insulin, specifically mealtime, multiple injections per day, you should have that real-time CGM because you need those alerts and alarms. You need that safety to make sure that we're capturing everything as soon as possible so that we can, again, keep you safe, healthy, and not just now, but long term. And I already went over the different types of CGM, so I'm going to skip those. And here's the system, right? So this is the inserter, the applicator. I have a demo right here that once I'm done sharing the screen, I can go over, but it's super simple. All you have to do is unscrew the bottom, press that down up against the skin, press that applicator button, and that patch is on your body. So like I said, I'm going to do a demo. I'm currently wearing one on my arm, and we'll go over that again in a second. And this is what's left on the body. Super tiny. We change this sensor out once every 10 days. So if you're doing 3-4 finger sticks a day, that's 3-4 stabs a day as compared to 1 stab every 10 days, and you get more value. It's a very good bang for your buck in that sense. And there is a Bluetooth chip in this Dexcom transmitter that sends the signal to either a smartphone, if you have a compatible smartphone, or a handheld receiver. So if you don't have a compatible smart device, then we have that handheld receiver to make sure that you can continue getting all of your glucose readings. And if you have that compatible smart device, it is Apple and Android compatible. You'll just have to look for the Dexcom G7 app. And like I said, if not, we have that receiver. And here's what you'll see once you start on Dexcom and once you start getting your readings. You'll have your current glucose reading, so where your blood sugar is right now, and that trend arrow. Am I stable? Am I rising? Am I falling? And then each little dot down here represents a glucose value that's been captured over the last 3 hours or 6 hours or 12 hours. You can change the view if you want to, but really it shows you again where you've been. That number shows you where you are, and then that arrow shows you where you're going. This yellow line and the red line, those are your alert thresholds. So if your glucose goes above that yellow high threshold, it will alert you saying like, hey, you should be notified that you're a little bit high right now. And then if you go below that threshold, it will alert you like, hey, you're low right now. And, talk to your healthcare team about proper treatment for hypoglycemia, but really giving you that instant notification in case you need to do something. If you're on insulin, sometimes, we're humans, we forget insulin. That high threshold is nice as a reminder of like, oh my gosh, I forgot to take my insulin. And then on the bottom of it, if you scroll down, you have what's called the clarity card. So not getting that instant notification or preview of what your glucose is, but getting that overall. How am I doing overall? What do I need to make changes for? So you'll have a statistical summary of what your glucoses were for the last 3, 7, 14, 30, or 90 days. And then seeing your percent time in range. So that's much more valuable than an A1C because you're not just seeing your average, which could be a lot of highs and a lot of lows, but you're seeing when you're in range, when you are below target, when you're above target. And that's extremely impactful, not just for you and how you're feeling overall, but for healthcare providers and your healthcare team to make changes for what your regimen is or possibly might need to be. And then here are the different trend arrows that you will see. All of these are normal. So I always say, I don't have the best diet out there. I love mixing my Cinnamon Toast Crunch and my Cocoa Krispies. Call me crazy. I tried it once when my blood sugar was low. It was delicious. Terrible idea. My blood sugar will rise every single time. I will have 2 arrows pointed up. And then when the insulin hits, I'll have 2 arrows pointed down because the food is absorbed really, really quickly. Well, first couple times after seeing that, I learned if I have something with more of a protein and maybe less of my Cocoa Krispies and Cinnamon Toast Crunch, I'll have less of that spike. And it's learning how my body responds to food. And I'm able to see that from the glucose readings. I'm able to see that from the trend arrows and make better decisions for my overall health. Probably not the best to have Cocoa Krispies and Cinnamon Toast Crunch, but it's a learning experience always. And then for indications and placement, so big question, where do I wear this thing? So patients from the ages of 2 to 6 years old, indicated all the way down to 2 years old, can go on the back of the arm or that upper butt area. If you're older than 7 years old, so if you're in the adult population, it's going to be indicated for the back of the arm. If there are issues that you cannot wear with the back of the arm, just consult your healthcare team to talk about other areas. What it's doing is it's measuring the interstitial body fluid. So we do need a fatty area, but what Dexcom has approval for is the back of the arm. And then one thing I didn't mention that's on the bottom here is that we have a 30-minute warm-up. So anytime you put a sensor on the body, regardless of brand, that sensor has to warm up and get saturated in your interstitial body fluid, get saturated and basically learn your body. Dexcom G7 is 30 minutes, whereas other brands could be an hour. Our previous generation was 2 hours. So it's extremely a shortened warm-up time that you will not get your glucose readings in between your sensor changes. Once every 5 minutes, honestly, that's only 6 glucose values that you're going to be missing. So if you're new to CGM, if you're new to Dexcom, this might not seem like a big deal, but as someone who has been using the product since the first generation, this is huge, huge. And then, perfect. Pictures that go along with the insertion. So what you have here is the app and the receiver that will both go through how to insert the product. We have wonderful tutorials online. We have a lot of resources. If you need more education, you have your healthcare team that can also talk to you. But basically, you're pressing a button to insert it. So once you unscrew that cap, you press it against the skin, click that little button right here, and then on your body, you have that little sensor. Okay. What you want to do is rub around the sides. The adhesive is pressure activated. So we're going to rub around the sides to get it to stick. Hold down for 10 seconds because most of the adhesive lives under that gray spot, which is extremely important so that all of it sticks. And then if you have an issue because you are a little bit extra sweaty or a couple months ago when it was the middle of the summer, or maybe we have oily skin, every sensor includes an overpatch tape. Since it's included, I would recommend that you use it just to help keep it secured. But this is really because with our previous generations, a lot of people called in to have the overpatches sent, and it just makes more sense to include it with every single box. So if you are concerned about it falling off, it is included with every single box. And then we talked about the high and low alerts. I'm going to kind of go quickly through this. But one thing I didn't say is that they're customizable. Not everybody needs to be alerted for their high blood sugar at 180 or 200 or 250. You can customize it to what you want it to be. You can turn it on and off if you want it to be. Personally, I wouldn't turn the hypoglycemia off, but that's for you and your healthcare team to decide. And then the only one that is not able to be turned off is something called urgent low. So if we hit 55 or go less, safety purposes, right? We don't want to be able to turn off urgent low. That one is not able to be turned off. But with G7, there are 2 additional alerts that I love to talk about. And the first one is the delayed high alert. So this is where you may not be notified about your high glucose until later. So optional, you don't have to put this on if you don't want to. But traditionally what happens is once you go above that high threshold, you get beeped, you get notified. Let's say you had food and that food is kicking in before your insulin or your body's insulin kicks in. You might go above that threshold for a little bit, but we're not going to do anything about that because we need to give our body time to absorb that insulin, whether it's your own body's insulin or insulin from a syringe. But if you're above target for an hour or 2 hours or 3 hours, that's when we need to be notified because that's when we're going to implement some kind of correction dose or some kind of change. So we can prevent that alarm from going off until it's actually useful information. And the hope is with the next gray picture that's going to come is that if you go above target and come back down into range, you will never hear that alert and alarm, which is important, one, to keep you sane because we don't want this thing beeping at you all the time. We want it to beep at you when it's relevant. But 2, some people may accidentally or mistakenly correct their blood sugar with insulin when it's not appropriate, causing hypoglycemia later. And this is to help prevent that as well. And then I think if I had to pick one feature, that's my favorite. I think this is my favorite with Dexcom. Urgent low soon. So if we hit 55, I said that was urgent low. With Dexcom G6 and G7, if we're dropping so quickly that we will hit that 55 mark in 20 minutes, we can get an alert. So right here, you will see that the glucose is 103, a normal blood sugar, right? We would just hang out with the blood sugar of 103 if I did that on a finger stick, because that's great. But because we're dropping so quickly, the system is detecting that in the next 20 minutes, we will hit that 55, alerting the user that you might want to respond now. You might want to treat now. You might want to react now. So this is helpful to prevent that really crummy feeling of being low, to prevent passing out and any kind of hypoglycemic seizures. And really, it can also prevent giving too many carbs when you're low and in turn becoming very, very high. So a lot of benefits from this feature, but for me personally, I think it's the safety of not having any kind of hypoglycemic emergencies or severe hypoglycemia. And then, just going off of the finger sticks versus the CGM again. So our boy Charlie right here, he's doing a finger stick and his blood sugar is 127. He's about to get in the car. He's got a 30-minute drive home, 127. Like I said, we're just cruising with that. We don't need to do anything. But if we see that we're 127 with 2 arrows pointed down, we can respond differently to that. If Charlie here is getting behind a car and he's 2 arrows down, that is not safe for him. That is not safe for other people on the road. And that can be a serious, serious issue due to a hypoglycemic emergency. Now with Dexcom, we can treat it differently, right? We can prevent the low rather than responding to the low. And I think that's something that in healthcare in general, we all need to get better at, is preventative medicine instead of responsive medicine. And another one from Diatribe, if I can tip my hat to those guys over there, the different faces of an A1C of 7. So if you're diagnosed with diabetes, the goal is to keep that A1C less than 7. Not everyone hits that. We're all humans. We all have different levels of how we're managing our diabetes. And that's for you and your healthcare team to determine. But what I want to say is that the A1C of 7 isn't always the best indicator of how we're doing. As I mentioned, we can have a lot of highs and a lot of lows and have an A1C of 7, but that's a lot of fluctuation that makes you not feeling well. Complications are still possible with that fluctuation, and we just can't know about that unless we have CGM. Whereas an A1C of 7, where we're in range more of the time, we feel better. We're having less complications, and it's showing us that with the CGM, we can see exactly where those trouble areas are so that we can address where that hypoglycemia or hyperglycemia are occurring. And I talked about the Clarity card. There is a Clarity app as well. So if you wanted to dive deeper into your blood sugars, which I'm sure your healthcare team will want to do, you can download the Clarity app. And what's cool about it is you can get weekly notifications. So every Sunday, I have a Clarity notification that pops up that says your time in range last week was, 71%. That's a 2% increase than last week. Maybe it was 65%. And that was a 7% decrease from last week, telling me I need to do something differently. And then it can also tell you, you have a pattern of high blood sugars or you have a pattern of low blood sugars between these specific time ranges. And if you ever have a pattern of lows, that's an easy time that you need to talk to your healthcare team. If you have a pattern of highs, that's an easy time you need to talk to your healthcare team, because the sooner that we address these hyper and hypoglycemias, then we can keep you healthier, adjust the medications if you need it, start medications if you need it, adjust some behavioral decisions, and like I said, just keep you healthier over time. I always laugh at this one. If you're doing handwritten logs, it's tedious for you to write, it's tedious for the healthcare team to look at, and it's very difficult to make out what's actually going on, as compared to when we look at Clarity. It's a nice, simple report that shows us exactly what we need to make the decisions quickly so that we can talk about more during your healthcare visit. Anybody who uses a smartphone with the G7 and the G6 app can share their data with family and friends. So I know I keep going back to myself. I have diabetes. I share my blood sugars with my wife. As long as I'm connected to the internet and she's connected to the internet, she can see my real-time glucoses from anywhere in the world. We both just have to have internet connection. If my blood sugar goes too low, she is notified. So if you live alone, if you have a kid off at college, if you have a kid in school, if you are just concerned and want someone else to have your back because it's just safer to have more eyes on your blood sugars, you can share with family and friends. You can share with neighbors. And honestly, you could even just set it so that if you hit that low or urgent low, they get notified. It's customizable for whatever you need and what they need. But it's just all there for safety. It's all there for peace of mind. And we really do have better outcomes with that as well. And then specifically to iPhone users, because the talk feature is not there for Android just yet, but you can ask Siri what your glucose level is. So anybody with visual impairment, anybody who's just lazy like me, or if you're in the car and you don't want to look down at your phone because it's really not safe to look at your phone while you're driving, you can ask Siri what your glucose level is. And he or she, however you have it set, will dictate what your current glucose is, as well as the arrow. So you're 143 and steady. Sometimes you don't want to hear what the number and arrow are, but it's just really valuable to see what it is. And then, I'd be remiss if I didn't talk about how Dexcom has done lots and lots of studies, right? A lot of studies to prove that it is as effective as we say that it is. So it will be effective in reducing A1Cs. It'll increase time in range. It will reduce the frequency of hypoglycemia, hypoglycemic emergencies. There is patient satisfaction that we're looking at, the quality of life. People, when they fill out their surveys at the end, are saying they're having a better quality of life due to wearing Dexcom. It's not just something that we're saying, try it and you'll love it. 4 out of 5 patients on Medicare who have tried this product stay on it after a year because it's extremely valuable. It makes your life easier and it can help you stay healthier for longer. And I think, living longer is always the goal, but living longer and a more functional life is the ultimate goal. That's the ultimate utopia. I mentioned that Dexcom does have a lot of resources available, whether you have just general questions and need some customer support, whether you have tech support and they're available 24/7, or if you need additional training and want specific training on the product, you can call in and get specific training. If there is a question, then there is someone who can answer it. And with that, I am going to open it up for any questions.
I have some questions just about coverage. So what does it cost for Dexcom? What does it look like for our geographical area? How would patients go about talking to their physician about getting a CGM?
Take that. So thanks for asking. These are great questions. So coverage in our geographical area is fantastic. So for the most part, all of your patients or patients in general can go directly to the pharmacy to get the Dexcom. We have over 3 times as many patients with a $0 copay as the competitors. So Medicare is the exception to that. With Medicare, as a patient, you would ask your healthcare provider for the Dexcom G7, and then that would be sent to a durable medical supply company. Super coverage, for the most part, goes directly to your pharmacy where you pick up your insulin and the lowest copay available.
Awesome. And if insurance would maybe deny coverage for a CGM, is there something patients and physicians can take steps to do?
Yeah, 100%. So if for whatever reason you have a patient that is on insulin and they receive a denial, first off, they can reach out to their healthcare provider. I am always available to kind of walk you through what that denial process looks like and, submitting an appeal. If a patient is on insulin, they should get coverage, and I'm here to support you. Medicare has loosened their guidelines. So believe it or not, if you are a patient on Medicare, Medicare is now covering Dexcom down to 1 shot of insulin per day. And if you are a patient not on insulin, but you do have hypoglycemia, Medicare will cover the CGM. So that's fantastic news. That's a recent update as of April, I believe. And then to follow suit, we have about 70% of our patients on commercial insurance, which are now following those Medicare guidelines. So we have more coverage than ever for CGM.
Awesome. Thank you.
Yeah.
I have a question. Oh, sorry, Kamal.
I have one point that I would like to make, and I was trying to actually say that in the beginning, but management of diabetes is evolving, so it's not staying the same. As our program director, Dr. Ripple Handal, we participate in his presentations, and every time we learn new things. But in some cases, we understand better as we hear it more. One of the main issues that I see, and Donna, you and I, we do our case conferences on a daily basis, and we can kind of look at the patients with the chronic illnesses, with their issues from the medication management, consult management, what happens to the patients who is dealing with diabetes. And one thing is very clear, that we see a variety of management styles on medications. And one thing that I learned from Dr. Handal's sessions is And why this is important for our patients is that because there are different medications, there are newer medications, and there's also mix of proper medications together to better manage diabetes. So I'm making reference to the extended release metformin with the regular immediate release metformin. Making that together is one of the maybe bases of why we need to actually monitor our glucose level, because throughout the day, certain things is happening. And if you take the medication at a certain time with the immediate release, it's going to do certain things right away, but then it's going to go down. And it's going to take, you are going to take it again, it's going to go down again. Or it's going to go up based on whatever it does. But with the extended release mix with the immediate release, so you have a base of keeping the level at certain point, so then you have a nice threshold. Then you kind of go up and down. That up and down fluctuates less than what it is before. So in order for the healthcare provider to make that decision better, they also need to see this, right?
100%. Yes. Yeah.
So
and go ahead. Sorry.
I mean, this is why also patients should really look into the best interest of their management of their disease, because if we know what's happening, it's one thing, but if we have the proper medication, that actually is going to help us with the successful management of diabetes.
Agreed.
And I would say, I think you hit the nail on the head, because there's so many reasons for why you might be having high blood sugars, and there's so many medications to address those reasons, but some medications just might be in a fad right now, and it might not be the right medication for you at the right time, where this can address the cause of the high blood sugars, and then we can put the proper medication. So you nailed it.
And Kamal, to your point, when CGM first became available about 20 years ago, I think we as healthcare providers looked at this as a tool for preventing hypoglycemia. And we would put patients on this kind of down the road in their therapy. CGM now has evolved with their accuracy to the point where this should be for first step. As soon as you are diagnosed, when you start insulin, CGM is invaluable. And it's not just for protecting those patients against hypoglycemic episodes. It's the patient that you or a primary care physician may see in your office that has an elevated hemoglobin A1C. It's the best tool that you can add that does not have side effects that come with it.
Yeah, definitely. And it's kind of interesting how, when our nurses, they present the cases, they are always kind of different. So they're never kind of like uniform, which I think one of the things that we are trying to do with our ACO is we communicate these differences with our providers. So this is where Dr. Hamdal does a lot of communication with our providers to see if we can actually kind of streamline how we are approaching the diabetes. And the other thing is really important, the way that we utilize our dietitians, our nutritionists. So I can imagine when you are not able to control the diabetes with medications, then you don't have dietitian on your side. So we have now 3-4 different people on our full-time people on our team. And I can see there's still some hesitation on utilization on both provider and from the patient side. But I think they actually complete the management, in my opinion, in the best way, and we'll keep supporting them as much as we can from our side.
And if I could just mention, from a provider standpoint, it takes the guesswork out of the diabetes management. But more importantly, from the patient's perspective, Ken mentioned the follow-up. Patients have reported an 89% increase of peace of mind by using Dexcom. It's tremendous. And by using a continuous glucose monitoring device, it reduces the burden on the patient. And that's huge. They have enough to think about with everything they put in their mouth, and how their body's going to respond. We want them to do exercise and be active, and those 42 factors that Ken pointed out. this is a tool to reduce the burden for these patients.
Absolutely. Absolutely.
And I think the one thing too, when Ken was showing the graphs, right, when everything, my 4 or 5 finger sticks a day were within range, right, then I'm getting a false sense of security, right, that, oh, everything's perfect. But when I have all the data to look at, then it might help me to look at my nutrition differently, or my exercise and my nutrition differently, of why did that happen? Why did it, go up? Why did it go down? And then they can better be able to make modifications to their daily routine, now, because they know versus when they didn't know. So I think that does make a big difference. And I just have one other question that I know some of our patients have. It's kind of unrelated to that piece, but when a patient is traveling, especially if they're going like to the airport or something like that, is there anything that they need to know when traveling, and wearing, the CGM? Is there anything, that they should be aware of?
Yeah, I'll take this one, Celeste. So actually with G7 only, not in G6, in our user guide, it says that it is safe to go through that scanner. So, where you have to like put your arms up and the wands go around you and feels like you're going somewhere futuristic. That is okay. That is safe. MRIs need to remove it before you go into that procedure. X-rays and CAT scans, if it's outside of the area being viewed and it's covered by the lead apron, our user guide says that it is able to be used. But specifically for traveling, you can go through that scanner.
Perfect. I think that's helpful. It gives, again, another level in case, right, the person doing the imaging or doing something is not aware of that or doesn't see it, right? I have a coat on, I have a long sleeves on. So I think that is important from a safety perspective.
And if I can just advocate when talking about traveling, there's this program called TSA Cares, where if you have a disability, you can call them ahead of time, say, I'm going to be at the airport at this time. They have a TSA agent meet you in the front. They can kind of escort you. So you only have to explain your condition to one person and they can help you along the way. That's something to look into. It is free, but you have to call them and schedule it ahead of time.
Good to know. Thank you.
All right. So is that all we have today?
I think so.
I'm looking at Caroline. I know she cannot see me.
I think that's perfect. Answered some of a really big questions. So yeah.
All right. Well, guys, thank you so much for joining us. So when we have support from different organizations such as yours, we do a lot of internal things, but when we have external resources, that also helps us a lot, and then increase our communication with our patients. And hopefully we can reach out to more people. Well, thank you so much again for joining us, and we'll see you soon.
Thank you for having us.
Thank you.
Bye-bye.